Hello everybody, I am Dr. Avisek Dutta, Associate Consultant, Department of Urology, CMRI Hospitals, Kolkata. Today I am going to talk about home remedies for kidney stones. So kidney stones is a very common problem and so many of us have had one or heard somebody has had one. So an important factor which everybody knows is a good amount of water intake. So what is an adequate water intake for somebody? We judge the adequacy of water intake by the color of your urine. If your urine is a pale yellow in color, that means you are having adequate amount of water. And if your urine is dark yellow in color, you should increase your water intake. Okay. And next is other specific factors in your diet that might affect your stone formation, like proteins. If you are having excess amount of proteins, it might increase the risk of stone formation. Increased proteins increase the risk of uric acid stone formations. So another important part of your diet is protein intake. So if you are having a high amount of protein, that increases the uric acid in your urine, and also a good amount of protein increases the acidity of your urine and causes increased risk of stone formation. So especially those who are having uric acid stones, you need to decrease your animal protein to adequate amounts. Next is sodium, which is commonly called table salt. We should have a limited amount of sodium in your diet, because if increased amount of sodium is there in your diet, it will increase the amount of calcium in the urine and cause increased stone formation. Third thing, which is obesity. Obesity increases the risk of stone formation, and we should aim at decreasing our weight to prevent recurrences in kidney stones. Some other things in your diet, like fruit juices, like orange juice or pomegranate juice, they increase the alkalinity of your urine and helps in decreasing the formation of calcium stones. Other thing in diet is that if we have calcium stones, we tend to avoid calcium in diet. But calcium is a very essential part of your diet, and calcium in diet helps in reducing the absorption of oxalate from your intestine and thus eventually reduce calcium stone formation. About oxalates come in spinach, tomato and other green leafy vegetables. Oxalates are also an essential part of your diet. So until and unless you have specific oxalate related stones diagnosed, we should not limit this kind of good foods from our diet. Finally, we should always preserve your stone if you get the chance to get one, and you should get it analyzed so that we can know the exact composition of your stone, and we can do a metabolic evaluation, preferably by a neurologist, so that we can tailor your needs accordingly and prevent further stone formation in future. Thank you.